Hey guys, it's Dr. Justin Marchegiani here. We are live. YouTube Hangouts has done some crazy stuff where they've taken some legacy software that worked really well and retired it. So YouTube Lives are a lot harder. I do not know how to schedule YouTube Live events in advance. So just know I'm going to be live here on Friday mornings, and I'll try to go live during the week, but it may just be at a spontaneous time. So it may take a little bit of time for you guys to kind of join into the meeting. So I'll try to choose a topic that I can riff on for 3 to 5 minutes, let you guys kind of get into the room and get some questions going before we dive in. I hope that helps. If anyone has some really good intel on going live, let me know. I've tried a couple of softwares and it's just not quite jiving with my YouTube channel. So hopefully we have a solution for that in the months to come. If not, I'm going to continue using my Zoom software, and hopefully this will be a good solution in the interim. So what's going on, y'all? Happy Friday. Hope everyone is doing phenomenal. What is going on? What's on your mind? What do you guys want to talk about? I'm all ears. All right, cool. A couple of questions here coming in. Let me just get my question list popped out here so I can see it. I'm going to try to do a live video as well this afternoon, by the way. So just kind of look for that. I'll probably go live here. Looking at my schedule, I'll probably go live here around 1 o'clock CST time today. So look for that. Look for that. All right, Pink writes in, Dr. J, what does a urine test with squamous epithelial cells mean? It depends. So like in a microscopic urinalysis, you may see squamous epithelial cells. You may also see white blood cell esterase, bacterial culture, pH. It could mean that there's some type of inflammation in the urinary tract, potentially a UTI issue. It depends. Typically, you're going to see other markers outside of just that. It's a really, really good question, but more than likely, I'm going to lean on a UTI type of issue. I'll try to look that up and get a little bit more info on that for you, okay? All right, great question. Yep, so it's normal to have 1 to 5 squamous epithelial cells in your urine. Having a moderate number of many cells may indicate yeast or urinary tract infection. So yep, correct. If the epithelial cells increase too much, UTI or bacterial infection in the urinary tract. Sebastian writes in, happy Friday. Thank you, Sebastian. Cade writes in, Dr. J, I'm 158 pounds, 6'4", male, following an AIP template. However, I'm losing weight, eating 2,600 calories. How can this be? Not enough calories, malabsorption, hyperthyroidism, high metabolism. So yeah, number one is it's probably not enough calories. If you're 6'4" and that lean at 158, you probably need maybe 3,300 calories. You can always run your metabolic rate through chronometer, kind of put your height, your weight, your activity level, your age, etc. And then it'll probably assess that for you. You probably need more calories. So I would just increase the amount of calories until your weight stabilizes. Also increase the carbohydrate too, calories as well as carbs. Make sure they're whole food, nutrient dense. Make sure your stools look good. Make sure there's not a lot of undigested food or just kind of malabsorption through the stool, HCl enzymes. And we may need to add in some kind of elemental type of formula to get extra calories that are all broken down to make sure things are dialed in. It's always possible there could be another issue going on, but those are like the foundational issues that are going to be common 99% of the time. So you want to rule those out first. Lambert writes in, after the antimicrobial treatment, do you normally follow with probiotics? And when do you reassess in case of no improvement happening during 2 months antimicrobials? So we would start with probiotics for sure. We want to be on probiotics for at least a month before we retest, because a lot of the probiotics can cool off the gut, reduce inflammation. They can even knock down critters. So it just gives us a little bit more time to have the gut look better on retest. And Lambert, yeah, we should have a follow-up consult, check in, see where you're at, and make sure there's no different adjustments or tweaks we can make in the meantime. Great questions. All right, excellent. K Gupta writes in here, do you prefer a GI map test over the GI effects test, 3-day collection? They both seem to be based on PCR. I definitely like the GI map over the GI effects test. The GI effects technology has changed. It seems to be less accurate. The GI map tends to be a lot better. Not a big fan of that. The Metametrics test used to be a good one. I think Genova bought Metametrics a couple of years back, and the quality seems to be less. I just never find anything of value on those tests. Used to run it a lot. Opinions on barefoot minimalistic running. I mean, I think there's a lot of good benefits with barefoot running. Of course, you just get to have your foot, not being supported, so that arch and all those muscles get to actually work appropriately. Again, if you're running on a hard material, concrete, asphalt, that's definitely going to be a little bit more of a stressor. So if you're going to barefoot run, have it be on some type of, softer type of surface, grass, etc. Didi writes in, my gut bugs love wheat as a prebiotic, better bowel movements and more energy. What are other prebiotics similar to wheat? Arabinogalactane, chicory. So yeah, you can do some prebiotic fibers. There's a couple that I use that are beneficial, that have some of those arabinolactone, inulin, chicory. You can also look at other safer starches. So you can look at any potato, sweet potato, squash, plantains, turnips, parsnips, jicama, rutabaga. You can look at a lot of those and see how you do. Of course, you want to be careful of gluten-containing grains because of their increased chance of increasing gut permeability. There have been studies actually showing, even if you're not gluten sensitive, that grains and gluten can increase the permeability of your gut lining. And that's really going to be the first domino that has to fall in an autoimmune condition. So be careful with that. Agnes writes in, would you recommend activated charcoal or bentonite clay for removing toxins? They have different effects, but activated charcoal is just a really good general binder. I have no problem with that. And it's pretty cost effective. Dennis writes in, Dr. J, I heard a psychiatrist say the paleo diet is not recommended for patients with OCD because it can deplete them of serotonin. Is that true? That sounds like absolute nonsense to me. So the first thing is you have to go back and you have to look at what's in a paleo template and how do you make serotonin? Serotonin is made from tryptophan. Okay. The question now is tryptophan high or very elevated in healthy animal products? Yes, it is. So you would just eat more protein. And you'd want to make sure that protein is digested. And you'd probably want to also supplement with additional amino acids as well. Again, I don't like the term paleo diet because it's really a paleo template. You can adjust the macronutrients accordingly. And if you need more protein, you can add more protein. But tryptophan, the precursor of serotonin, is going to be the most dense, the most nutritionally dense in animal products. So I don't know any other product or any other diet that emphasizes healthy animal protein outside of a paleo template. So that does not make sense. Agnes writes in, are hair analysis tests accurate? Do you recommend them? I don't recommend them because people are looking at the different mineral ratios and what's coming back in the hair. Well, what if you have a thyroid issue? You're going to have poor hair growth anyway. What if you have a malabsorption in the gut? All those nutrients have to get through your gut and be absorbed to actually even go into the hair anyway. So there's too many upstream markers, or let's just say roadblocks that can affect the downstream measurement of hair analysis. So I'm not a big fan of it. I'd rather look at the upstream things versus the downstream things. Oliver writes in, how long do minor Achilles strains take to heal? Any tips on recovery? Yeah, so you need to actually get to the root cause of why it happened. If you're a male and you've taken like a fluoroquinolone antibiotic, those are common at actually weakening tendons and ligaments. So that's a big stressor there. Number two, you really want to get to the root cause of why that is. So if there's any stressors, you want to improve collagen, you want to improve elasticity of the muscle. You want to make sure your other muscles are turned on. So you want to see a good applied kinesiologist or a good functional movement person that can test and assess the muscles, help provide soft tissue or specific electrical support to help stimulate the muscles and help them soften up and relax. My colleague and good friend Garrett over at NewFit, NEU.fit. He's a great person. He's in Austin as well. He has a bioelectric device called the Newbie that works phenomenal and can help with that stimulation. It helps improve blood flow, decrease inflammation, and helps with muscle pliability, which is important. Problem with a lot of people that tear muscles is, one, other muscles in the surrounding area aren't working properly. Number two, those muscles that get torn are typically like beef jerky consistency because they're so inflamed. Beef jerky tears versus a nice soft tenderloin is more of a shock absorber. Okay, excellent. Sebastian writes in, Dr. J, for a while after working out, I get extremely jittery and feel extremely wired for days. Takes about 2 days to get back to normal. Just wondering, what could it be? Blood sugar, adrenal? Yeah, it could be a combination of those two. I would make sure that you have a really good post-workout nutritional support, good protein, good fat, or good protein and a little bit of carbs after your workout. You may even do well sipping some protein and or sipping some BCAAs during your workout. And I would just adjust the intensity and the duration of your workout back so you don't feel that. You should always feel better after your workout. You feel like you can emotionally repeat it, and that later on that next day or that next following day, you feel okay. So if you're jittered up, your nervous system cannot handle it. Rob Kelly writes in, any explanation as to why I'm having sugar cravings after dinner? I don't experience this after breakfast or lunch, still seeing gains on the protocol. Thank you. Oh, thanks, Rob Kelly. Appreciate it. So off the bat, the biggest reason why people tend to have more cravings at dinner is if someone eats at 12 or 1 and their dinner's at 6 or 7, there may be a longer gap between breakfast or lunch and dinner, maybe 5 or 6 hours, where maybe during the day you were going 4 hours or 5 hours. So maybe a little bit more of a gap. That's number one. So you may need to eat and then maybe eat again an hour or 2 later and just have a healthier snack, maybe some berries or coconut cream, some good fat, carbs, protein. You also just may need a little bit more carbs too. And you may just want to play around with adding a little bit more carbs in and see how you do. Hope that helps. Lambert writes in, except for antimicrobials, what's your opinion about biocidin? I think biocidin is a good one. I do use it with some patients. Is there a good way to increase calories if you have slow digestion, fat malabsorption, and want to stay paleo or keto and don't do well with elemental diet products? So if you want to increase calories, so you can always just add in more fat. So if you have slow digestion, so you got to maximize enzymes, acids, and bile salts if you're having fat malabsorption. Number two, you have to figure out why that is the case. Is there an infection? Is there some kind of gut stressor that's creating a malabsorption? So you got to increase all of those macronutrients, increase the fat, increase the carbs, and you probably would do better with the elemental type of formula to give you extra calories that are already pre-broken down. Tapioca starch seems to be a problem, then just cross it off your list. Go to greener bananas, go to other types of starches that are safer and see how you do. Susan writes in, I was taking Ultra Cavanase PM, now it's unavailable. Is there a way to get in Europe or suggestions for sleep? I take L-theanine, 5-HTP, and CBD. That's good. You can always try adding in some melatonin. You can always try other forms of GABA as well to help. Phenibut worked well, which is in the Ultra Cavanase PM because of its effects. It was essentially a GABA agonist. So it upregulated the GABA receptor site. So you can do more GABA. Liposomal, you can do more magnesium and L-theanine, which is great. You could also do more melatonin. And you can also work on increasing 5-HTP with B6. Chronic conditions writes in, Dr. J, have you seen any research on inflammation and depression connection? Yes, I have. And a lot of the newer medications that are going to be antidepressants are actually working on inflammation in the brain. The difference is they're going to do it via some blocking some enzymatic pathway that may cause more problems. If you remember the cyclooxygenase inhibitor, Vioxx, that blocked the COX enzyme, cyclooxygenase 2. And when that enzyme was blocked, that enzyme was needed to regenerate heart and gut tissue. So it created heart issues and ulceration. So you block one enzyme over here for something, it may be used over here for something else. And that's the problem with using a drug to manipulate metabolic pathways. There's other enzymes that are important for other beneficial things. So you want to do it naturally. Higher dose fish oil, higher dose curcumin, CBD, good natural anti-inflammatory support, resveratrol, etc. You're welcome, Sebastian. Julie writes in, I'm dealing with autoimmune markers, was tested for Sjogren's twice and negative, allergies and chemical sensitivity. Yeah, you need to work with a really good functional medicine doc. You need to get worked up. Look at your diet, look at stressors in the gut, look at your digestion, look at how your hormones are doing. Especially women are more prone as they go menopausal because their hormones start to drop, and then that can fluctuate their immune system and make them more prone to autoimmunity. So look at that as well. When estriol drops, that can really affect the immune response. Dave writes in, so many great answers in the session already. Thank you. You're welcome, Dave. Gabe writes in, ganglion cysts, what are symptoms and natural ways of treating? Ganglion cysts are pretty benign. I'd have to do a little bit of research on it, but you could always do like a apple cider vinegar in like a cotton swab and kind of bandage that around the cyst. That can be helpful. You can even make like a paste of curcumin and mix it with apple cider vinegar and put that on. I've seen that really, those kind of poultices work really good at treating topical issues. Lambert writes in, tapioca, maltodextrin, don't you think there was a problem in elemental formula during the antimicrobial regimen? It depends. There are certain elemental formulas that are lowering carbohydrate. Some formulas with the tapioca are good because it baits out some of the critters. You probably don't want to do both the elemental and the antimicrobial at the same time. The only reason why you'd want to add in the elemental is because you're also looking to have extra nutrients and because your tummy does better with less food to digest. So I would add an elemental, kind of a modified elemental in there, maybe the first 6 hours of the day to one, provide nutrition, but two, to kind of give the tummy a greater chance to digest and rest. And this would allow your just to feel better. So people that feel a little bit worse in the morning, adding solid foods, that would be the best reason to add that in. K Gupta writes in, what's the difference between the oat from Genova and Great Plains? And why do you prefer one over the other? So the oat from Genova has more markers in regards to glutathione. It also has more markers in regards to like B vitamins and the mitochondria and more gut bacterial markers. So it just depends. I like the detoxification markers. I like the gut bacterial markers. I like some of the mitochondrial markers. The Genova test, or I should say the oat test from Great Plains, does have oxalates on there, which are nice if people are getting exposed to mold. We may see the diarabinitol high, which is a fungal marker. We may see very high amounts of oxalates. So I do like the oxalates that are tested on the GPL. I kind of go back and forth, but I tend to like the Genova more than the oat. Taluga writes in, please tell us heavy metal detoxifying supplements. In my line, I have one called Heavy Metal Clear. That's a more gentle heavy metal detox. It has citrus pectin. It has chlorella, which are just kind of good, gentle binders for heavy metals. There's also some glutathione precursors, which can be helpful. We may want to work on additional glutathione. We may want to add in additional B vitamins or extra liver tonifying herbs like milk thistle or silymarin or dandelion. I typically do not touch heavy metals though until the gut is working well, because heavy metals will get pushed out via the hepatobiliary system. That's gallbladder, liver. That means it'll dump it in the intestinal tract. And if your gut's not working well and you have slow transit time and your gut's already a mess, it could make it even worse. So you really want to make sure you have your gut lined up. The Korvac writes in, is apple cider vinegar good for digestion? What's a good dose? Yes, it is. It's acetic acid. It lowers the pH. It helps activate proteolytic enzymes. Start at 1 teaspoon and work your way up. Dave C writes in, I'm curious about the latest info on treating hydrogen sulfide SIBO. Got any updates for us? Maybe that could be its own podcast. Yeah, that's really good things. And not so much on the hydrogen sulfide. I don't really myopically focus on SIBO because I find a lot of the other infections or a lot of the gut tests that I find other stressors that could be part of this whole SIBO cascade. And if I address those, a lot of times the SIBO takes care of itself. And I use enough broad spectrum with some of the herbs that I have already that it tends to help and benefit that. But I'll keep an eye on that and we'll look at a new podcast topic for that. Lambert writes in, do you think there's a connection between low thyroid and leukopenia? So leukopenia meaning just kind of abnormally small white blood cells. Anytime your thyroid's lower, your metabolism's lower. So your ability to metabolize and regenerate cells are going to be on the lower side, possibly. But if you have stress in the gut, that's where 80% of the immune system is. So if you have chronic stress in the gut, then it's going to be harder to kind of remake and recycle a lot of your immune cells. 80% are going to be in the malt and the galt. Galt being what's in the stomach and the malt being what's in the intestines. Robert writes in, are Viome stool samples any good? My opinion of Viome is way too much information. Not much of it is actually actionable. That's the problem. Not much is actionable. And it doesn't look at potential infections that could be causing the bacteria to go out of balance. Meaning if your diet's really good and you have a couple of infections and your gut bacteria comes out of balance, well, if you address the infections, the bacteria may just start to get back into homeostasis on its own, where they may say, well, you have to eat avocado and spinach, that'll fix it. Well, maybe not, because if you have this other stressor that's pushing things out of balance, it's not that simple as just eating food. I've seen so many patients that have had chronic health issues that have done a Viome test and then have seen the generalized recommendations, followed them, and it's like it didn't do anything. So I have a lot of reservation for that test. Lambert writes in, apart from GI-MAP, which other stool tests do you trust as a second check? There's a DRG lab. They changed their name recently. I like them as well. The 401H from BioHealth is a good one. And the 3 sample through doctor's data is also a good one. All right, guys, I got to roll. I got a patient I got to call here. I will be back on for a live video around 1 o'clock CST. Look forward to you guys checking in. And I hope you guys have a phenomenal Friday. Put your comments down below. Let me know what you think. Give me feedback on future podcast topics. If you love this, give me a thumbs up. Hit the bell button, subscribe, and share with your friends and family so they can benefit. All right, y'all, you have a phenomenal day, and we will talk soon. Take care. Bye.